Welcome to Cura Conversations, Tales of Hospitality Excellence, where we dive deep into the realms of the people, programs, and culture that make up Cura Hospitality. Malnutrition Awareness Week takes place from September 8th to the 12th and is an educational campaign founded in 2012 by the American Society for Parenteral and Enteral Nutrition, or ASPEN for short. And this addresses the critical issue of malnutrition in healthcare, especially among hospitalized patients. The campaign's success has elevated malnutrition as a global health priority and inspired other organizations to initiate similar awareness efforts. Today's guest is Tricia Goncher and comes to us with over 35 years of nutrition and food experience. Tricia is a registered dietitian and the clinical nutrition manager at Indiana Regional Medical Center and the Punxsutawney Area Hospital for Cura Hospitality. She will be sharing some insights on malnutrition, including some symptoms, how we treat it, and ways to prevent it. Thank you for joining us today, Tricia. Why don't we start by having you tell us a little bit about yourself and your career?
Well, thank you so much for having me on. I appreciate it very much. A little bit about myself. I've been kind of born and raised in this area in Indiana, Pennsylvania, graduate of IUP in Seton Hill, and started my career actually in long-term care in a non-traditional path. Went back to school a little bit later I had my bachelor's and went back to school later than to become registered. Transitioned from long-term care into acute care, where I spent a lot of years at a level 1 trauma center. And then I've been here at Indiana Regional Medical Center for the past 5 years as the clinical dietitian and the clinical nutrition manager. And then also we recently took over the clinical services at Punxsutawney Area Hospital. So I become the CNM there as well. Certified in nutrition support. So that's one of the things that I always enjoy, that part of my career, as well as doing the CNSC and the nutrition support side of it.
Awesome. Well, we're super excited to have you on the podcast today. You come with a wealth of experience, and as we're celebrating Malnutrition Week, and really trying to raise some awareness to malnutrition, the first question I have for you is, what is malnutrition and how is it different from undernutrition?
Well, malnutrition, like if you're looking at the ASPEN, which is the American Society for Parenteral and Enteral Nutrition, they define that malnutrition as an acute or subacute or chronic state of nutrition in which a combination of varying degrees of overnutrition or undernutrition with or without inflammatory activity lead to a change in your body composition or diminished function. So that's a pretty complicated clinical definition for it. Cleveland Clinic has actually a simpler one that just defines it as an imbalance between the nutrients your body needs to function and the nutrients it actually gets. So that, I think, simplifies that a lot better. Undernutrition is a type of malnutrition. So it's one of the 4 types. Specifically when your body doesn't get enough of the essential nutrients, including the energy, protein, and or vitamins and minerals that all of our bodies need to drive the processes that we need to function. All of the chemical reactions that have to happen in our body to make everything metabolize food and all of the things that we need to happen. So, and one of the things that many people don't realize is that malnutrition can also include overnutrition and or imbalances, those kind of things that also can lead to negative outcomes.
Awesome. So, you talked a little bit about what malnutrition is, but what are some of the main causes of malnutrition?
There are so many causes of malnutrition. It is definitely a multifactorial condition. There's kind of 3 categories that we look at for malnutrition. One is the starvation or the inadequate intake. And those things can all be contributed into that are, limited financial resources or lack of access to nutritious food insecurity. That's one of the huge contributing factors. to an inadequate intake type of malnutrition cause. Mental health conditions can also interfere with eating, such as depression or dementia, or having, especially on the dementia side of it and the mental health side of it, having somebody that believes that food is poisoned or something to that effect. That can have a dramatic impact. Eating disorders such as anorexia or bulimia. Sometimes a very restrictive diet can also lead to inadequate intake. Early satiety things sometimes also are component of some of our more elderly patients that we take care of. And inadequate care can also lead to that starvation or inadequate intake, particularly in children or the elderly. Some of the other causes that we look at are more along the lines with chronic disease, and those conditions that affect either the ability to absorb or utilize nutrients appropriately, such as something like pancreatic insufficiency or inflammatory bowel disease. Prolonged infections also can increase our inflammation. Something like C. diff can also impact the inability to utilize and absorb nutrients. Conditions, things like cancer and obesity, cystic fibrosis, those all can have an impact in increasing what our nutrient needs will be to battle those diseases. Conditions that also impact our ability to eat, such as chronic nausea, or that can be seen in things like gastroparesis, or if someone has difficulty swallowing. Chronic disease malnutrition is usually accompanied with a chronic inflammation that can be mild to moderate degree. When you talk about acute illness or injury-related conditions, these are going to be usually your hospitalized malnutrition patients. These are going to be patients that have had surgery, some sort of traumatic injury, a burn patient, a pressure ulcer could be, a severe thing. And this also usually is accompanied by an acute and a severe inflammation that also can definitely drive up our nutrient needs. So those are the three main categories of malnutrition that we kind of look at. And of course, there's a whole lot of things that also can factor into that, but those are kind of some of the main ones that we look for.
Awesome. Thank you for explaining that. When we look at malnutrition, what are some of the signs and symptoms that an individual should be on the lookout for if they feel they might be a little malnourished?
Well, the signs and symptoms of malnutrition, when you look at it, there's several clinical characteristics. And there are actually 6 that you look at for signs and symptoms of malnutrition. Inadequate energy intake, weight loss, body fat loss, muscle mass loss, fluid accumulation, and grip strength. And each one of those are further defined by specific criteria and timeframes within the ASPEN framework that actually determines malnutrition. To determine, like, you've had inadequate energy intake over a certain amount of time, and a certain, like, less than 50% of your normal, those sort of things. You're also looking, when it's a little bit more progressed, you're going to see impacts on things like your eyes, hair, skin, nails, all of those sorts of things. Those all can kind of speak to that micronutrient deficiency side of things, not just the macronutrients with energy, where you're looking at muscle wasting, fat loss, emaciated appearance, those sort of things.
Thank you. So you talked a little bit about the 6, symptoms and signs of malnutrition. Do you need all 6 of those to be diagnosed with malnutrition, or is it a combination, or does one take, a higher precedence over the rest? Can you explain that a little bit?
In order to be diagnosed with malnutrition, you need to have 2 of those 6. Any 2 of those 6 need to be present in order to be diagnosed. Then, depending on the severity of the intake, the weight loss, the muscle mass, all of those sorts of things, depending on those, it will determine if you are considered a severe or non-severe malnourished patient. one of the key things and the best tools that we have in our tool belt to diagnose malnutrition is definitely the nutrition-focused physical exam. Those things will definitely be able to help assess those clinical characteristics and determine how long or how severe a patient's malnourishment really is. One of the key things about this too is that we've definitely moved away from using albumin as an indicator for malnutrition at all, as it is in a negative acute phase protein and it's impacted by inflammation. We definitely do not use albumin as an indicator for that any longer.
Thank you. So, if you have a patient or an individual who is malnourished, what are some of the treatment options for them?
Well, some of the treatment options, I think it depends on finding out what the root cause of that is. So you're going to gear your treatment based on what the reasoning for it is. If it's an outpatient setting, you're going to look at, is it a food insecurity issue? Is it a busy family and a mom running kids to practices and can't kind of manage the whole meal prep situation? I guess it's not moms and just moms anymore. It's moms and dads, everybody, that sort of thing. So you kind of really have to hone in on what the cause of it is. But there's kind of also several categories that we look at for treatment for that as well. So we have some food-based strategies. And those things are going to include, enriched foods, adding things to foods that people normally already eat that are going to increase your calories, like butter, brown sugar, sour cream, those sorts of things. Those can all enrich foods. You're going to be offering frequent snacks throughout the day to kind of just make hay while the sun shines, so to speak, and get patients in more calories in throughout the day. And honoring food preferences. That's a big part of making sure that people have the foods that they like to eat, rather than putting a plate of food in front of somebody that they just have never eaten in their life and they don't care for. So you have to kind of obtain and get those food preferences and then make sure that we can honor them. If those food-based strategies aren't enough, then we can move to supplementation. And there's different options for supplements. There's commercial supplements out there, such as Ensure or Boost. Or there's also, you can make your own type of supplement, like a milkshake, a fortified milkshake, that sort of thing, smoothies with protein powders and things like that. There's also vitamin and mineral supplements that it's important, though, to ensure that there is an actual deficiency in a vitamin and mineral first, either with a physical exam or with confirmed by a lab test, rather than just automatically supplementing with vitamins and minerals. And then in more severe cases, you're going to look at nutrition support. And that's going to either be enteral nutrition or parenteral nutrition, depending on the ability of your patient's digestive tract, their ability to eat. And sometimes you use a combination of any of these things. You can use enriched foods. You can have patients that are eating as well as receiving nighttime tube feedings for extra supplement. You kind of can look at those. On the clinical support side of it, you can also, one of the treatment options could also be looking at referring patients to a diabetes educator, maybe to get better control of their glucose, which also has an impact on inflammation and all of those sorts of things. So if you're going to be looking at sending patients for diabetes education or possibly to a speech therapist, if they're having trouble with dysphagia and need mechanically altered diets, and helping with those sorts of options. Or even just an outpatient dietitian too for follow-up. Could be for weight management, either for obesity or underweight. Those outpatient follow-ups are very important too after a patient leaves the hospital or the facility, to make sure that they're followed up with adequate nutrition care. And you want to make sure that you're continuing with the monitoring and evaluation to make sure that the plan of care that you've put into place is working. Maybe they are getting vanilla Ensure and don't like vanilla, want chocolate. it could be something as simple as that, as changing the flavor of a supplement, or maybe they need the rate of their tube feeding changed. So you always want to make sure that you're also monitoring and evaluating that to make sure that you're modifying whatever interventions need to be changed to meet that patient's needs.
Well, thank you. And, I know you talked a lot about how we could help solve for malnutrition after the individual already has it, but how are some ways that it could be prevented?
I think that also goes back to primarily you have to get to the root cause of what could be the cause of that malnutrition to start with, or what puts a patient, I guess, or a person at risk for it. And that could be things like food insecurity. Do they have access to adequate health care? Especially in the case of children, are they getting to the doctor to make sure that they're meeting those percentile goals, that sort of thing. And it can also be just plugging people into programs that are available, like things like the school lunch program, WIC, Meals on Wheels, food banks, all of those things too, to make sure that they have those available resources to them if you're talking about community. In a facility, one of the key things to preventing malnutrition is having that early recognition. In long-term care, we use the mini nutrition assessment. In acute care, we prefer the malnutrition screening tool, which just basically asks 2 questions of, have you lost weight and have you had a decreased appetite? And if that answers either one of those questions are positive, then that will trigger a consult to the dietitian for them to go speak to that patient and get to the root of what is causing either weight loss or decreased appetite. And then you get those early interventions in place. And that makes a big difference in their outcome in the long run.
Thank you. So I know you shared a lot with us today, but I also know that's just, really the tip of the iceberg. So if anybody wanted to learn more about malnutrition, its causes, how it's treated, anything like that, where can they look to find that out?
There are so many resources out there for malnutrition. ASPEN, actually the American Society for Parenteral and Enteral Nutrition, it is Malnutrition Awareness Week, and they have all kind of resources on their website. The Academy of Nutrition and Dietetics also has a lot of resources available on their website. They also support it's called MQII, which is the Malnutrition Quality Improvement Initiative. And there's all kinds of things available on there as well. There's articles, there's videos, there's all kinds of resources that are available through them. As well as Cura is putting together a malnutrition implementation guide that will have all kinds of resources for clinicians to be able to recognize and treat malnutrition. And that will be coming soon.
Awesome. So, well, before I get on to the last question, I will also thank you, because I know you're playing a part in that implementation guide and the development of it. So thank you for continuing to share your knowledge. But as we wrap up, is there anything else you would like to share that, we didn't talk about?
I would just kind of just reinforce the fact that, malnourished patients are much more likely to have longer hospital stays, much more likely to have that 30-day readmission rate, which definitely has financial implications to the facility, and negative outcomes for the patient. They're much less likely to be able to go home and have to be sent to a facility. So early recognition and early intervention are the absolute keys to success for any malnutrition diagnosis and intervention. So be on the lookout the minute they kind of hit the doors.
Awesome. Well, thank you so much for spending some time with us and sharing your knowledge and expertise.
You're very welcome. Thank you for having me on.
Thank you for joining us on today's episode of Cura Conversations, Tales of Hospitality Excellence. And a big thank you to registered dietitian Tricia Goncher for joining us today and sharing her expertise and knowledge on malnutrition. We hope you found our discussion on today's topic insightful and engaging. And as always, until next time, happy cooking.
Since 1996, Cura has specialized in serving life plan communities, behavioral health, and acute care facilities. Cura creates dining service programs specific to each client's needs, taking the worry of guest safety and satisfaction, employee development, and operational and fiscal challenges off our clients' plates. As our clients' needs evolve, so do we. We are a company of experienced dining service professionals that is part of Elior North America. Together, we are small enough to care and big enough to make a difference. Thank you for listening to Cura Conversations, Tales of Hospitality Excellence, and we hope you will visit us at curahospitality.com to learn more about how we nurture well-being with every meal we serve.